Hello again. Welcome to another episode of the OIS Podcast. I'm your host, Sophia Pathai. Now, they do say the eyes are the window to the soul. And for sure, that's true and profound and poetic. But nowhere else than ophthalmology is where we really believe this to be true. And certainly many systemic diseases can be detected in the eyes even before we can detect them clinically. But I'm going to go back to the real world rather than poetic. And I know that we need great imaging devices to enable that. So I'm thrilled today that we have two gentlemen from Heidelberg Engineering, which many of our listeners will be familiar with. It's well known for its integrated imaging devices, and particularly in optical coherence tomography and the spectralis. But they are much more than that. And so that's the reason for today's podcast. So I'm thrilled today to have two of the company's senior leaders, Kfir Azoulay, Head of Corporate Strategy at Heidelberg Engineering GmbH, and Tosh Vadhia, Managing Director of Heidelberg Engineering UK. Welcome to you both.
Hi, Sophia. Thank you for having us.
Thanks for having us.
So, of course, we want to learn more about Heidelberg Engineering, its history and its future. But to start with, we'd love to know more about your individual career journeys and your arcs that have brought you to Heidelberg Engineering. Tosh, you're local to me across in London, so why don't we start with you first?
Great, thanks. Yes. Well, overall in ophthalmology, probably in various facets, about 28 years. So I originally trained as an orthoptist and I decided then to go into the commercial side of the business. So I've been in various commercial factions of ophthalmology in terms of pharma and then device sales management and then head of sales Northern Europe to kind of arc all the way around to kind of GM and MD now of the UK operations. So lots of commercial on the ground experience for me.
Thanks for sharing. And I really want to pick up on that real world kind of grassroots experience as we dig deeper into, what digital and tech means for us on a day-to-day basis. So thanks so much, Tosh. And Kfir, why don't we pass over to you? I know you've got a variety of different experiences, so I'd love to hear about that.
Sure. Well, I started working in the medtech and ophthalmology industry over 20 years ago, like Tosh. And I won't say exactly how long ago, because this morning I actually learned that I was older than Rishi Sunak, the new British Prime Minister. And I'm still processing that. So suffice to say that I started over 20 years ago at a company called Luminous, formerly known as Coherent Medical to many in the industry. And that's where I got exposure to different medical areas, including ophthalmology. And I quickly fell in love with the ophthalmology field. And over the years, I climbed up the proverbial corporate ladder until I became vice president and general manager of the ophthalmology business of the company. And in the process, I also completed the basic clinical and science program in ophthalmology and got an MBA focusing on health economics. And approximately 8 years ago, I was approached by Heidelberg Engineering, which I consider to be one of the best things that ever happened to me professionally. And I joined the team in Heidelberg as head of corporate strategy, focusing on various strategic and long-term initiatives of the company. And I think it was around 4 years ago that I was offered the role of managing director of Munich Surgical Imaging, or MSI, which is a wholly owned company of Heidelberg Engineering. And this company specializes in fully digital microscopy and image-guided surgical applications. So I've been wearing these two hats for the past few years.
Wow, it's quite an inspirational journey. And I also resonate on the Rishi Sunak age things for sure. And what I think, I noticed for both of you is, there's always been these touch points with ophthalmology, right? Tosh, your background as an orthoptist, and Kfir, your kind of practical and theoretical application of your knowledge into the ophthalmology field. And so let's dig a bit deeper into Heidelberg Engineering. I mean, Kfir, you mentioned one of the best things professionally that happened to you. In ophthalmology, the community, of course, knows of Heidelberg Engineering and of their devices, but we don't know that much about the company. And it's almost quite hidden in some ways. We know it's a privately owned company. So we'd love to know more about the inception and journey of Heidelberg Engineering. And maybe both of you could share your perspectives, maybe Kfir and then Tosh, tell us, what you think, how the story's been evolving and sort of where you feel the company is going now.
Sure. Well, I mean, Heidelberg Engineering is a really unique company. And I know it sounds a little bit like a cliche, but I really mean it because it really kind of stands out and stands apart in the ophthalmology industry, in my opinion. And what really sets it apart is a genuine commitment to the science, to image quality, to setting the standards. Our mutual friend and colleague for me and Tosh, Kristen Williams, she calls it, how did she say that? We are contributing to the ground truth in scientific and clinical care in ophthalmology. And I think most of us really kind of wholeheartedly believe that. And I mean, as a company, we have offices in more than 7 countries worldwide. We have more than 600 employees. Our sales this year are nearing 150 million euro, which is a record for us. We have an impressive installed base of systems, really renowned academy and education programs, and I think you know that. Great relationships with scientific and clinical researchers, collaborations with pharma and biotech companies. Probably and on and on. And I'll leave something for Tosh to say as well. The only thing I can say is that we are a privately owned company, and our co-founder, Christoph Schoss, is still kind of fully involved and engaged with the company. And his daughter, Ariana Schoss Vargas, is also now a managing director in the company. And she's gradually now taking over kind of all the day-to-day leadership activities. So we are fortunate that we have kind of this smooth generational change within the company, because that's not something that you take for granted. And I'm sure you are familiar with many cases where this is not the case. So we're happy that this is the case. The only sad thing is that unfortunately 5 years ago, actually it's really almost 5 years ago to the date, it's next month in November, that we lost Dr. Gerhard Zinzer to illness. And he was a co-founder of the company and really a beacon of innovation in the field of ophthalmology in general.
And Tosh, any thoughts you want to add to that very comprehensive overview?
Yeah, just to kind of distill down the essence of the company, I think Kfir touched on a little bit in terms of the co-founder owners, Christoph Schoss and Dr. Gerhard Zinzer. I think when they started the company more than 30 years ago, to obviously get to the size of the company that we are now, it really is quite unbelievable. But I think their initial drive and passion really did rub off on a lot of the next generation or the wider company employees. They were very, very approachable. Christoph Schoss still is today. I get emails and messages from him asking me about the industry and various things. And I think when you see that drive and you see that passion, I think it kind of truly distills what the essence of the company is. It really is still quite close knit. We're only really, there's hardly any hurdles to go through in terms of, talking to the owners. That means, I think, even from its early inception, we're actually very quick to react to opportunities. And I think Heidelberg have been very, very good at that over the years in terms of the Heidelberg Group and its various acquisitions underneath that. But also in this kind of, age we're in now, where everyone's talking about having a vision and being innovative and being leaders, I think you can have as many PowerPoint presentations to try and drum it into you, but you're either kind of, born with it and you have that innate drive and that's passed on to the employees, or you try and learn about it in various training modules.
Well, let me kind of drill down onto that aspect. You talked about the close-knit kind of family aspect and really getting to know the organization. But also, I think from my interactions with you, it also is a reflection of the relationships you built with customers as well. Yeah. So let me understand from you, Tosh, from your role and from your tenure in the organization. Tell us more about, how do you build that relationship that is so productive and collaborative with customers, not only ophthalmologists, but orthoptists, photographers, everyone in the ophthalmology community. And how do you nurture that relationship? And, how does that help maybe in product innovation? Maybe you're getting feedback and learnings, from the community. So how do you leverage your role as a leader in the company, but also as someone who's so connected to the customers to get the best out of your devices and of ophthalmology in general?
Yeah, and I think since we started the UK subsidiary back in 2011, I think education was the kind of cornerstone in terms of making sure that the customers got the most out of the equipment, because like a lot of Heidelberg products, they do a lot more than they probably the customers and even the staff even think, you know, I mean, but I think going back to what Kfir said, you know, having that innate truth in what we do and actually believing in the product that will make a difference in a clinical setting is very, very powerful. There's lots of, you know, equipment out there. So why is it ours so different? Because we kind of stand behind and we believe that it does give better clinical outcomes. And in that patient's management, that's very, very telling. So we have a very loyal customer base who obviously understand that we are one of the best when it comes to imaging. But like anything else, a great image is a great image, but actually what's the data coming out of it? And the wider community, which is what Heidelberg have been part of for quite a number of years, is the research community. And actually that again almost feeds back into the whole story of better patient outcomes from a clinical setting, because we're so heavily involved in research.
Thanks, Tosh. Great insights. And I want to translate that over to Kfir because, you know, you're at the kind of the very front end of innovation and establishing new business relationships. So tell us more about, you know, focusing on the innovation space. What projects have you been working on? You mentioned Munich Surgical Imaging. I think I also understood there's a collaboration with Bausch Lomb. So tell us, you know, what's happening, what's keeping you busy, and where's the future for you?
Sure. I mean, this is really an exciting period for Heidelberg Engineering in general, but also for me personally. And maybe just to give you kind of the greater backdrop of this Munich Surgical Imaging story, you know, we as a company, we had not planned on going into this field. And like Tosh said, we, as a privately owned company, we have the flexibility of being opportunistic, and I mean it in the most positive way. But we had always kept kind of a close eye on all innovation in the market, but also specifically in this field. And for a long time, we had felt that kind of the digital microscopy space was interesting, but that the technology wasn't mature enough. And I think it was a few years ago already that we came across a 3D surgical visualization technology that kind of really blew our minds away in terms of the image quality. I'm talking about parameters such as kind of the depth of field, the color reproduction, resolution, contrast. And I mean, we immediately thought what a game changer this could be if we espouse, so to speak, our core competences in diagnostic imaging and in OCT in particular, which we are renowned for, together with this 3D technology. And that's essentially what we've been focusing on ever since we acquired that technology and created Munich Surgical Imaging in Munich. But originally we were actually planning on bringing this technology to market by ourselves because that's what we normally do.
Yeah.
But I think at one point we quickly realized that selling capital equipment to the OR was not really our core expertise or operational expertise. So that's when we approached Bausch Lomb, with whom we'd partnered before on in other areas, and they are kind of an industry partner in certain aspects. And I have to say, to their credit, they immediately saw the potential and the synergy of combining kind of this technology with their really extensive surgical product portfolio. And maybe to go just straight to the core, I mean, we showcased the system for the first time at in the past month at eRetina, ESCRS,
right.
And AAO. And this, it was an incredibly positive reaction from surgeons. Wonderful. And, we're really looking forward to working with the surgical community on kind of developing new surgical applications and finding ways to change surgical intervention that could, in a way that could improve outcomes and reduce adverse events and find new ways of doing kind of new things.
Well, thanks for sharing that. And it's so great to hear the positive immediate feedback around what you're doing. But maybe I can challenge Heidelberg a little bit on this and Tosh, to you in particular. So, Kfir's given this wonderful scope of what's on the horizon, but we know that you're in at the grassroots, as it were, seeing customers. So how do you think this technology can actually be adopted? Will it be adopted, knowing, your expertise of market access and reimbursement in so many of the European and Western markets? So what's the reality versus the optimism, is what I'm asking.
The reality is, and I think it's always been, it's not even this amazing new technology that's obviously, breaking boundaries in digital microscopy, but actually with the spectralis OCT, and then obviously with the anterior and anterior segment OCT, it's always been about that kind of purity in terms of image quality, first of all. And actually, what does that mean in real terms when it's translated down to ophthalmology in terms of a clinic and then the patient? It really comes down to clinical efficiencies. At Heidelberg, I've always been about having a shorter time space between diagnosing a condition and then the management of that condition. And I think from the digital microscope point of view, that just adds into that story quite nicely. But across the board, it's just really about elevating standards of care, reducing the burden for clinicians to obviously have so many compartmentalized products and data packages, and I think, as I alluded to before, the Heidelberg family also has German company called Medical Communications in its group as well, which obviously is a PACS-based radiology system. So again, data management from all these devices we've got is managed securely, and it's obviously managed efficiently. And then we then look at what we're doing with regards to electronic patient records, especially in the UK. In the group, we also have Medisoft. So again, data management going into the electronic patient records. I'm really, really keen that from a clinician's point of view, that they see as much rich data and imaging in that electronic record as possible. That in itself will increase clinical efficiencies, no bounds, and that's really across the board,
No, well, thanks for sharing the reality, and let's hope it is indeed that case. Now, Tosh, we've also, touched upon your interaction growing within the company since 2011. Talk to us about that journey, because you've had a subsidiary in the UK. It started off, I know, with a much smaller number of folks in the organisation, and you've built it out over time. And you've had to deal with challenges of, let's face it, Brexit, MDR. Yeah. The kind of global chaos of coronavirus, of course. So talk to us about that journey in the company. How did you, start building a culture, and, what challenges, apart from the obvious, tell us about the obvious and the other challenges we may not have seen, but been very instrumental for the organization?
Yeah, I mean, anyone who knows me, fortunately knows I love a challenge. So obviously,
I know that for sure. That's why you're here today.
So when I took on the GM and the MD role, I mean, I think one of the challenges coming into it was obviously being extremely customer focused on the ground, to suddenly be behind a desk and obviously look at the financials in terms of trying to, manage spend v income, and obviously looking at efficiencies that can be made, but also just trying to distill what the customers need and what they want into that general company vision. And I think I've learned from myself that I'm pretty good at what I do. You know what I mean? I'm a pretty good at understanding what the ophthalmology trends are out there, and trying to be a kind of, forward thinker leader in how we sell, market, and distribute products and support our customers. Surprises wise, I think I'm a pretty good, as I said, visionary, if you want to use that word, in terms of I like to really understand ophthalmology as a whole, every facet from, research to not just the kind of space that we're in, medical retinal glaucoma, but now we get into surgical. So I think having that appetite for ophthalmology and understanding that there is a patient at the end of it, and that's who we are ultimately serving, and this is a service that we're providing to our customers. I think that mantra has to stay along, especially in the healthcare field.
No, wonderfully said. And, I completely agree. You are definitely someone that, really stemmies up to the challenge. And thank you I've seen that, and people speak so highly of you in the ophthalmology community and what you're doing for us. So thank you for that. Now, Kfir, you're at the forefront of innovation in ophthalmology. You're seeing all the new technologies coming through, creating new technologies for us to use in ophthalmology. So many words are used, digital, metaverse, omnichannel. So tell me, let's sort out the wheat from the chaff. What do you think are the big trends for you? Nothing confidential, of course, but where do you see the excitement for you personally and for Heidelberg Engineering with the ophthalmology lens on?
Well, Sophia, I mean, yeah, you touched on a lot of buzzwords there, and I think you also know from kind of your extensive experience in the investment world, how often you come across the buzzwords and how big the gap is oftentimes between
Right.
what you hear and what the reality is. And I have to say, I personally subscribe to the famous Gartner model that talks about kind of the peak of expectations, and then which is probably the pinnacle of the hype, and then you have kind of what they call the trough of disillusionment, and only then you kind of gradually achieve what one would call as a kind of a stable growth adoption vector for kind of any given new technology. So maybe to nitpick on one example, which I think we've all been hearing a lot in recent years, and I think 3 to 5 years ago, this was really the case maybe with AI. Only now, I think we are finally getting to the point where we're seeing applications that provide real clinical value as well as workflow value. So, I mean, this is the nature of technology, the way it reaches the market, and it goes through iterations and a certain process. And it's fine. I think you just need to know at what phase you're in as any individual that is involved either in investments or in bringing such technology to market, because you don't want to be there too early or too late to the game. But I mean, with this caveat kind of aside, and since I cannot go into anything that is one would define as confidential, I'm personally excited about kind of the wave of digitalization in the OR, but I'm obviously also biased. But if to put aside for a moment kind of the digital microscopy, I mean, I'm excited about the promise of biomechanical imaging, elastography. I mean, this could potentially shed new light on afflictions such as, let's say, glaucoma and even cataract. I mean, I believe in the promise of metabolic imaging. I mean, this really has the potential to usher in a new era in early detection of diseases. I mean, even more so than what we currently term as kind of the preclinical stage. But also with the identification of new OCT-based biomarkers for diseases such as AMD, neovascular or non-neovascular. And I'm probably neglecting so many areas right now. But really, the emergence of new biomarkers in this field is something that could change the way clinical care is offered. We're seeing a lot of exciting stuff in the pipeline, for example, for geographic atrophy and other areas. So I'm hoping that we could, in the same way that Spectralis and OCT enable the adoption of anti-VEGF injections and the follow-up and the care, I hope we can do the same thing also for the anterior segment with Anterion and for the retina with Spectralis and its next generations.
Yeah, wonderfully said. I feel like that's almost like a white paper abstract there, where you talked about the kind of future of ophthalmology. And it's rare, that we have completely new insights, but I feel you have shared some here today, particularly the biomechanics, biomarkers, and metabolomics. I think these are really areas that are very nascent in ophthalmology. So you really ought to share more content, your thoughts around this, because I think we all have a lot to learn from this. And talking about learnings, I just want to ask you to both, as leaders in the space, you both speak so passionately about and authentically about your belief in what you're doing and how we can all serve the ophthalmology community, and particularly by virtue of what you're doing at Heidelberg Engineering. So I'd like each of you to tell me, what are your leadership values? Have they changed over time? And what advice might you give to anyone who wants to emulate your career path? So maybe Kfir, we'll start with you.
Sure. I guess the first advice I would give to anyone kind of entering the field of ophthalmology is to really invest the necessary time and effort in learning this field. Because, I mean, it's, as we all know, it's not an easy subject matter. And the eye is kind of a labyrinth of optical, anatomical, and physiological complexities and idiosyncrasies. And I think your credibility as a leader really depends on your ability to kind of hold conversations with stakeholders in the field, or in any subfield for that matter.
Very true. And if someone had told me I was going into a labyrinth in ophthalmology, I may not have taken that path. So
we tell them after they join. That's the trick.
Very true. Very true. And Tosh, how about you? You've obviously, had experiences in the organization, but also, inspiring, emerging leaders in ophthalmology as well. So talk to us more about that.
Yeah, I mean, just to kind of sort of dovetail exactly what Kfir said, I would probably say alongside the industry and the book learning, and you really have to get into the clinics. You learn so much more. Fortunately or unfortunately, a bustling NHS AMD clinic or glaucoma clinic will soon show you the pressures that our customers and the patients are under. And I think you will actually get so much more insight into the clinical workflow, which, for a medical device company, in terms of the things we're talking about now, having that experience in the clinic, talking to clinicians, going into sit in a clinic just to see what the roadblocks are, really does help a lot in terms of visualizing how you're going to provide a solution to try and fix this. Everything that we do here and I try and do, it's always evidence-based. It's obviously extremely, clinically relevant. Almost thinking sometimes like a researcher when obviously even a commercial organization helps a lot, because then that bolsters up the direction and the vision you want to take.
Thank you. Yeah, well said. To kind of really, both of you resonated on that fact. You just need to know the language of ophthalmology. And, sort of related to that, if folks want to know more about, the very comprehensive education that Heidelberg Engineering provides, or want to know more about the technicalities or the specs, how should folks reach out? Maybe, Tosh, you could tell us the easiest way to get through.
Yeah, we have a wealth of information, on our Heidelberg Business Lounge. It's probably more in depth than we as employees even take sort of use and advantage of, in terms of understanding what the technology can do. Obviously, there's lots of clinical relevant data there, and it's all in manageable chunks, whether it's obviously in videos and paper format, or like this in a kind of podcast as well. So a wealth of information about the company and about our products and how we're striving to make a difference.
And Kfir, you are, of course, leading corporate strategy. And we all know there are so many entrepreneurs and budding entrepreneurs who listen to this podcast. So if anyone's got a wonderful idea, feels that it might resonate with the scope and vision of Heidelberg Engineering, how should they reach out to you or your team?
We're very approachable and responsive. Usually at trade shows and meetings, that's the best opportunity for an in-person conversation. So anyone that stops by the Heidelberg Engineering booth, we'd be happy to engage in such conversations, or simply contact us by email. And if you cannot find the email address, you pick up the phone and call Heidelberg Engineering, and you'll easily get that information, either Tosh's email or my email, depending on the subject matter.
Sounds wonderful. Well, thank you both for this foray into Heidelberg Engineering. I certainly learned a lot more about the company, its vision and purpose, and it's wonderful to speak to two leaders in the space. So Tosh Vadhia, Kfir Azoulay, thank you very much both for joining us, and thanks for your time.
Thank you very much, Sophia.
Thanks for listening to the OIS Podcast. Tune in next week as we chat science, medicine, and industry with ophthalmology's leading experts. Visit OIS.net for more information on podcasts, events, and exciting new features.